Now we move to Middle East and Eastern Mediterranean, West Asia with Dr. Farhoudian. So I'm happy that we are something like 4 minutes behind the schedule. So hopefully we'll push that forward, making sure I will make that happen on time. So Ali, please.
Thank you. Good time, everybody. I am Ali Farhoudian. I'm a psychiatrist in Tehran University of Medical Sciences. I would like to introduce Iranian Institute for Science and Technology of Addiction, which is the first rank ISM affiliated societies. Of course, with regards to its collaboration with ISM in the recent years. ISTA, or Iranian Institute for Science and Technology of Addiction, has been established with the aim of improving the science of addiction, teaching it and expanding by holding workshops, by doing some researches, and holding monthly symposiums, as well as yearly International Addiction Sciences Congress in Iran, which enjoys having some board members of ISAM and other eminent professors from different parts of the world. After the pandemic emerged in the world, we started our initiative with ISAM in this field by writing, as Mohammed mentioned in his introduction, by writing a position letter from ISAM. It was the first recommendation letters. It was the first protocols in the world in terms of prevention, treatment, and harm reduction for people who use substance in the world. In parallel, we conducted two-phase surveys to find out how the pandemic struck the other peoples with substance use disorders, and as well as how the countries reacted to this catastrophe. The results of these studies has been published and is available in PubMed. At that time, the scientists suffered from a lack of evidence about the pandemic and about how they should have done in this situation. In collaboration with ISAM, we searched and find different levels of evidence and categorized them in a Dropbox and made them available to the people who are connected to ISAM. And the last, not the least one, was holding the first ISAM regional meeting in Asia, that it provide a network in Asia, and I hope it will continue more. Thank you for this opportunity to me.
Thank you very much. Now we have Dr. Mohammed Rafiq Azizada from Afghanistan. Mohammed, could you hear us?
Yes, thank you. Good morning and good evening, everyone. Many thanks for ISAM President, respectable Alex, and Regional Council, Mehdi, Khoury, and also Greg, for organizing the assembly. I'm Dr. Mohammed Rafiq Azizada, as a harm reduction specialist at the Ministry of Public Health. Please, next slide.
Yes.
About the society, I should say that the formal registration of the society is in the process, because you know that it delayed because of new government. Government changes. So because of that, it is under the process. Now, the recent political changes and also the freezing of assets had a great impact on the service deliveries, particularly for harm reduction services and also for drug demand reduction services, detoxification treatment. And its impact on the staff salaries, supply of medicines, and supply of equipment, and etc. Around 30 people, Afghan professionals, are working for Afghanistan Society of Addiction Medicine as a teammate and also as a volunteer. And one focal point is science, which is already me, and for coordination and also for communication for the international networking and for international communication. And we have two other co-workers for right now. Next slide, please. About the current status, I have said, and we are focusing and sending advocacy for legislation of this Afghanistan Society of Addiction Medicine with the new government. I mean, with the current government. And as you know, may know that more than 3 million people are addicted in Afghanistan, and they need detox treatment and harm reduction services and drug demand reduction services. And the limited of drug users have access to detoxification and also for harm reduction services in the country. I want to mention a few challenges that long war in the country, poverty, immigration, displaced migrant, and also cultivation of opium in the country. It is a big challenges. Existing of stigma and discrimination against people who use drug, and also there is no sufficient fund for service delivery. Low knowledge, I mean, in the country, there is low knowledge of people about the addiction and also about the using drug. And using of methamphetamine increasing day by day in the country. This is another challenges. And also HIV risk minimizing services to men and to women with high risk behavior is near to collapse. Next, please. Next slide, please. What we need strong advocacy for legislation of the Assam with new government, and also advocacy for increasing fundraising and fight against the existing stigma and discrimination. And about the services, we currently have RM reduction services for people who inject drugs, including OEC, and also drug demand reduction services. I mean, detoxification treatment centers for people who use drug. Our expectation from ISAM to support for conducting international conferences and also networking and webinar in the country, to increase free membership for Afghan professionals to obtain fellowship and also on addiction knowledge, and to sponsor and support Afghan professionals to attend abroad conferences and training, and to share updated knowledge, experiences, researches, and also lesson learned on addiction. And our contribution to ISAM, the society will share relevant policies.
Mohammed, we cannot hear you.
And also current situation of addiction with ISAM, and also the society will share relevant information, experience, and the conferences to global networking and by ISAM. Yeah.
Thank you very much, Mohammed. Thank you very much for presenting and joining us with all the complexities that we know that are happening in Afghanistan. Hopefully things would settle down there with all those kind of challenges that people in Afghanistan are facing. So let's move forward to the next speaker, Joseph Khoury from Lebanon.
I can hear you, Mohammed. Thank you for this. Can you hear me?
Yes, perfectly well.
Okay, thank you. Thanks. So basically, it's our first really interaction with ISAM, although I had heard about the organization and its amazing work. I'm the president of the Lebanese Psychiatric Society, which is the umbrella organization for all things to do with psychiatry in Lebanon. And this organization does look after anything to do with addiction as well. So there's no specific organization for addiction medicine. And this is for various reasons, including the size of the psychiatric workforce in Lebanon. If I can go to the next slide, please. So the LPS is the only official organization representing psychiatry in Lebanon since 1991. The current membership stands at 55 members. So when we compare to the 7,000 and 5,000 we heard of, we're like a minuscule organization. And out of these, many of you might have heard about the situation in Lebanon and the exodus of doctors, the collapse of the healthcare. So we might have lost 20 or 30 just in the last 6 months, which is almost 30%. So we are in a difficult situation, and we were in a difficult situation to begin with, but there are good things to be said about the kind of work that was being done on addiction in Lebanon. We are the reference when it comes to the Ministry of Health or to any public officials in terms of advice on mental health and addiction. They don't always listen to us, but at least they do consult us officially, which is already a foot through the door. And the current priorities is to maintain whatever achievements have been sort of created over the last 10, 15 years. Interestingly, Lebanon is one of the very few Arab countries to have an opiate substitution program running since 2012. And we're trying now to maintain it because, believe it or not, the medication has completely stopped arriving to Lebanon. So this is probably the first time in history that from one day to another, more than 1,000 patients will be having to be detoxed immediately from opiate substitution. So we're looking for a solution. We're learning. Obviously, we'll be sharing these kind of experience with our colleagues, and it's a bit about this idea of being able to work in systems under economical and political pressure where things change a lot. And I think the addiction field needs to be able to be responsive to these needs. And I feel, having heard from other organizations, that this could be an opportunity for us to collaborate on these things. We need to improve the training of local doctors. Very few of our doctors have formal training in addiction. A lot of them work in addiction, but maybe I would say not more than 5 or 10 would have formal training in addiction. And that means that the quality of and the complexity of the offerings are slim. Next slide, please. So what do our organization members expect? ISAM provide pretty much what everybody else has said. We look forward to network, on research, on collaboration, even on collaboration on clinical matters and training modules. We would love to be involved in support in setting and implementing guidelines. Again, guidelines for our regional sort of specificities or on a global level. What we can contribute, despite our small number, our output in terms of research and in terms, and again, having had this OST program in an Arab country with all the cultural, religious, and economical limitation is something that we can sort of support other countries with. And our members are keen on research and have a reasonable track record in it. That's it for me, and I'm looking forward for future collaboration with everybody today. Thank you.
Thank you very much, Joseph. Thank you very much. Now we have Rabia Bilici from Turkey.
Hi, everyone from Istanbul. As you know, Istanbul is a bridge between Asia and Europe. After my presentation, you can pass to the Europe. I'm a professor of psychiatry, and I'll represent the Addiction Psychiatry Association here. I can say that it's a very young organization when compared with the other organization in this meeting. We have 110 members. Most of them, all of them are psychiatrists working in the addiction field. It is one of the critical platforms that brings professionals together. And also it organizes national addiction congresses annually. And it also has an essential role in training professionals working in the addiction field. Next slide, please. What do we expect from ISAM? We want to be regularly informed of activities carried out by ISAM. I'm not sure that all of the members of our association is aware of ISAM, so we need more information about ISAM. We want to take part in interest groups with different colleagues, and we want ISAM to support especially our young academics to participate in ISAM conferences. What can we contribute? We can host one of the ISAM conferences in Istanbul. It will be a great meeting, I hope. And we can carry out the Turkish leg of international research projects. And we can provide support in international trainings. We have a team who had the training of trainers for UTC curriculum. Thank you for having us. That's all.
Thank you very much. Thank you very much. Now we have Mohammed Al-Junaibi. Dr. Mohammed.
Hi, everyone. First of all, thank you for giving me the chance to represent the National Rehabilitation Center. I'm Dr. Mohammed Al-Junaibi, consultant psychiatrist. Today, I'm going to represent the National Rehabilitation Center. It's a governmental entity in United Arab Emirates, Emirates of Abu Dhabi, which is specialized in providing addiction prevention, treatments, and rehabilitation services to all genders and in different age groups. Our multidisciplinary team consists of psychiatrists, internists, psychologists, social worker, nurses, and other supportive operational staff that help us during our daily tasks and activities. Actually, the NRC strategic plan consists of 6 priorities. First one, enhancing addiction-related health awareness practices. Second one, provision and developments of evidence-based treatment services and programs. Third one, provision of rehabilitation and social reintegration services. Also, contribution in improving addictions treatment service system regionally and internationally, as well as enhancing the role of training institutes in building capacity. The 5th priorities is increasing the NRC capacity in order to meet the increased demands of the services. The 6th one is improving the patient experience through developments of our building infrastructures. Next, please. At the NRC, we are looking forward to be the regional sites for ISAM training programs, and also we are looking forward to be the regional sites for ISAM certificate exam. Also, we are looking forward to have joint research programs or plans. Actually, since 2019, NRC proposed the following plan with ISAM. NRC ISAM competency-based training physician working in all fields with model focused around specialty fields of addiction medicine. Second one, NRC ISAM annual conference fellowship, which can support researchers and physicians from less resourceful countries to participate in ISAM scientific activities. The third one, Global Challenge Prize in Addiction Medicine, which can contribute to minimize or eliminate the major global threats to humanity arising from addiction. Thank you very much.